general examination and diagnostic techniques, heart murmur, and auscultatory findings in different valve disease. Heart murmurs, auscultatory finding in different valve disease. Heart murmurs are produced by turbulent blood flow across some normal cardiac structures such as valves. The following outlines key auscultatory findings associated with various valve disease. Aortic stenosis murmur types, systolic ejection murmur application best heard at the second right intercostal space. OT area and radiation radiates to the carotids. Characteristics crescendo decrescendo pattern, often associated with a slow rising pulse, pulses turdus. Mitral regurgitation murmur type, holosystolic pansystolic murmur. Application best heard at the apex and radiation radiates to the left axial. Characteristics are maintains constant intensity from S1 to S2 may be associated with palpable drill. Aortic regurgitation murmur type, only diastolic murmur location best heard at the second right intercostal space. Radiation may not typically radiate, and characteristics decrescendo murmur, high-pitched blowing sound often associated with bounding pulses, corrigan pulse, and mitral stenosis murmur type, with the diastolic murmur location best heard at the apex with the bell of the stethoscope, and radiation limited radiation characteristics, low-pitched rumbling accentuated in the left lateral position may be preceded by a opening snap and tricuspid regurgitation murmur type, holosystolic murmur location best heard at the lower left sternal border, and radiation may radiate to the right of the sternum. Characteristics intensity increases with inspiration, Calvolo sign. Pulmonic stenosis murmur type, systolic ejection murmur location best heard at the second intercostal space. Pulmonic area radiation radiated to the left shoulder and neck. And characteristic crescendo decrescendo pattern may be associated with an ejection clip. High-yield auscultatory tips positioning murmur of mitral origin best heard with the patient in the left lateral detubated position. And respiratory effects, right-sided murmur generally increase in intensity during expiration. Left-sided murmurs are better heard during expiration. Use of bell or diaphragm. The bell is superior for detecting low-pitched sounds like mitral stenosis, while the diaphragm is better for high-pitched sounds like aortic regurgitation. Each valve disease has distinctive auscultatory features that, when recognized, can lead to a quick and accurate bedside diagnosis, detecting directly further confirmatory testing like echocardiography. So let's sum up. Heart murmur, auscultatory findings in different valve disease, aortic stenosis, systolic ejection murmur, best heard second right intercostal space, aortic area, radiate carotid, crescendo decrescendo, slow rising pulse, pulses pertussis. Mitral regurgitation, holosystolic pansystolic murmur, best heard at the apex, radiate to the left axilla. Maintains constant intensity from S1 to S2 associated with a palpable drill. Aortic regurgitation, only diastolic murmur. Only diastolic murmur, aortic regurgitation, best heard at the second and right intercostal space, may not typically radiate. Characteristics decrescendo murmur, high-pitched blowing sound associated with bounding pulses, corrigan pulse, and mitral stenosis. Mid-diastolic murmur, best heard at the apex with the bell of the stethoscope. Limited radiation, low-pitched rumbling accentuated in left lateral position, preceded by an opening snap. Tricuspid regurgitation, holosystolic murmur, best heard at the lower left sternal border, may radiate to the right sternum, and intensity increases with inspiration. Calvolo sign, pulmonic stenosis murmur type, systolic ejection murmur, rotation best heard at the second and left intercostal space. Pulmonic area radiated to the left shoulder and neck. Crescendo positioning, left lateral decubitus position, respiratory effects, right-sided murmur, generally intensity during inspiration, left-sided murmur during expiration. Use of bell detecting low-pitched diaphragm, high-pitched like aortic regurgitation.